answer is in the skin tone, as you've heard on this show. We're talking about liposuction, and liposuction is a body contouring procedure that's really been done a lot since 1970 when it was first done here in the United States. My guest this evening is Dr. Robert Zubowski. That skin tone, that skin texture, I want people to really understand that again about how important that is and why that is a part of the realistic expectations.
Yeah. Well, because we're relying on that skin to redrape, to conform to a new foundation. And if the skin is not resilient, if it's not able to conform, it's going to sag, and we're going to not get the result that we're looking for. So that's why it's really so important.
So we're going to go right back to the phones, and we're going to take your call. Iris, you're on the air.
Hi, how are you?
Fine, thank you.
My question is, basically, I'm 20 years old. I'll be 21 at the end of the year. And I was looking into this, and basically I just want to know, at what age do you recommend and at what weight?
What age and what weight? How old? You said that you're going to be 21.
In November.
Okay. How much do you weigh?
I'm about 210.
And how tall are you?
I'm about 5'6".
You're 5'6" and 210.
Yes.
So we have a little disproportionate. Your body mass index is probably greater than 30. Okay. And so you are overweight, obese at this time, and you're looking at it because you want to begin the process of what you want to achieve in your goal?
Well, basically, I've been working out since I was, in high school.
All right.
And I'm not getting any kind of results. I've spent money for personal trainers. Like the young lady said, I've been on yo-yo diets, but nothing seems, I don't know what I'm doing wrong, something.
Okay, now let's just stop. Before I turn this over to Dr. Zubowski, one of the things that we talked about earlier on the show, the beginning part, is the fact that 40 to 70% of what you're dealing with is your genetics.
Okay.
The rest of it, just look at your family tree and see about those designer genes for obesity, okay? That's part of it. So don't beat yourself up because of your genes.
Okay.
All right. Now, if you've been really working out and you've been watching your diet and trying to change your lifestyle so that you can sort of modify that, then a patient who has this particular situation, Dr. Zubowski, how do you begin? She is definitely obese.
Right. And
she's 21 and she's trying hard and it hasn't worked. Where do you begin with this patient?
Well, I think you begin with a well-controlled program of diet and exercise. I know, you've been on the diets and the yo-yo diets, and you're up and down and so on and so forth, but I think that if we're going to look to get the best possible result, we want to be able to contour appropriately, and we need to have some contour to match. And if there's generalized obesity, it's very difficult to contour anything. We're just removing fat, and that doesn't really accomplish much. We would send you to a nutritionist, to an exercise program, and have you try to lose as much weight as possible. It's the most difficult thing that I have to do when I see patients come in for liposuction, to turn them away because they're too overweight. They walk out feeling very badly. In fact, just the other day, I had a patient who 6 weeks prior, I said, "Hey, look, I can't operate on you. You're just too heavy." She came back 6 weeks later, lost 25 pounds, and it was a perfect candidate for suction. So
the contour, the body, you have to be able to look at what the body would eventually look like, the shape. And if you don't have that because there's too much fat,
right,
then you can't get the results that you want.
Right.
So that's why you have to go back to the medical model, work with the nutrition, the diet and exercise to get to a point where it would be beneficial to the patient.
Right, and that point is not necessarily an ideal body weight, but it is not a morbidly obese body weight, and it's certainly somewhat close to where your ideal body weight should be.
Okay, let's go back to the phones. Dennis, you're on the air.
Hello?
Hi, Dennis.
Hi. Thanks for taking my phone call.
Well, you're next.
Great. I've got two questions.
All right.
One is lidocaine. I understand that's a drug that's administered for this procedure, and I also understand that if you have heart problems, that that could be a problem to the patient. I just want to know when that drug is administered for liposuction. And two, my second question is, I understand it's very important where the procedure is actually performed.
You mean where as far as?
Well, just hear me out.
On your body or?
I understand that if there is a problem, from what I've read, that if the facility does not have emergency room, quote-unquote, equipment, that the patient can become in danger if something does happen.
Great questions, Dennis, and I want to get to them. Number one, the medication that you're talking about is called lidocaine, and it's an anesthetic. And Dr. Zubowski talked about that a little bit earlier with regard to what's injected prior to the suction. So it's lidocaine, and it's and he also raises a very important question which deals with the death rate, because there was a paper that was reported from Pennsylvania Medical School, University of Pennsylvania Medical School in Thomas Jefferson, that said 1 out of 5,000 deaths happen with this procedure. And one of their biggest concerns about that had to do with what Dennis raises here for who's doing the surgery and where the surgery is being done. First, Dr. Zubowski, about the medications injected in, lidocaine, epinephrine, and next about the safety of this procedure, where it should be done.
Yeah. Well, you know, the questions are very, very good, because this gets to the heart of a lot of the controversy that has recently surrounded liposuction. And that is the training and the expertise of the surgeon doing the procedure. Because the complications that arise through liposuction predominantly involve the medications that we give and the amount of fat that we remove. Those are the two biggest contributors to all the complications that we see. So firstly, you need to have a board-certified plastic surgeon who is doing your procedure, or at least someone who is trained thoroughly in liposuction. Now, you know, the way to find that person would be to check with the local medical board or medical society, to call the American Society of Plastic and Reconstructive Surgery, or even to check at the local hospital to make sure that your surgeon has privileges to do that surgery at his local hospital. And that assures that he's met certain criteria of expertise and knowledge to be able to do that procedure. Secondly, liposuction is done most commonly at ambulatory surgery centers in plastic surgeons' offices. These offices and these surgery centers should be certified by one of many different kinds of certification boards to assure a certain level of quality care. That's the second thing. Thirdly is that, in general, outpatient liposuction should be done at relatively low volumes. A lot of the problems that people can get into is when they do what we call large volume liposuction. Large volume means more than about 5 liters of fat. Once you get beyond that, you can run into problems with fluid shifts and other injuries to the body that can occur as a result of removing so much fat.
We're going to talk about that and more when we come back. What are the side effects and what are the differences between the procedures? The answers to those questions and more when Dr. Zubowski and I return from these brief commercial messages. So please stay with us.